Hello and welcome to another episode of LABORvision, brought to you by your friends at KDHX, Community Television for St. Louis and beyond. I'm your host, John Hickey, and right now Congress is debating whether to include a public option in the federal health care reform bill. Doctors are on the front lines of health care, and today we look at how do doctors look at the public option as part of health care. Let me introduce our guest to you. We have Dr. Bill Fogarty, a longtime primary care doc here in the St. Louis area. Thanks for being with us.
You're welcome.
Dr. Fred Rotnick, a past guest on LABORvision, may be familiar to some of our regular viewers. Thanks again for being with us.
Okay.
And then Tim Greeny, who is at the St. Louis University Law School and head of the Center for Health Law. And Tim, I'm going to actually throw it to you first and ask, what is the layman's version of what the public option means?
Well, the public option is one piece of the health reform legislation that's wending its way through Congress right now. It's one important piece, I believe, perhaps one of the most important, but it's also turned out to be one of the most controversial. To put it in perspective, what's going on now is Congress is considering a program that will insure or help insure some 40 million uninsured citizens. To do that, they are going to do some expansion of Medicaid, the poverty program, but for the most part, they're going to rely on insurance program competition to meet the needs of the people. The public option will be a government-sponsored plan, but it won't be a government subsidized plan. It will be a plan that will have to compete on its own merits against the private plans. So people will have a choice among private insurers as well as the public option.
And Dr. Ratnick, I was reading recently a new poll in the New England Journal of Medicine that said that almost 2 out of 3 medical doctors want to see the public option in federal health care reform. Why is that?
Physicians are frustrated today. We're spending more and more of our time on administrative tasks, things of figuring out what kind of coverage patients have. With private insurance, coverage changes quite a bit, not only for treatment options, but for medication as well. And physicians are looking for a way to change things. Keeping things as they are is not really an option when it comes to our healthcare task force today, because physicians are getting tired of their current system. They're getting frustrated with the demands that third-party payers put on them. And we're seeing evidence of that with a lot of mid-career burnout for physicians right now. People leaving the field when they're in their 40s or early 50s, no longer doing direct patient care.
And in your own personal experience, Dr. Fogarty, how would you look at the role a public option could play?
I think the public option would fill a huge gap for people who are unable to access commercial health insurance. For instance, people maybe between 55 and 65 who have not reached Medicare age, lose their job or change jobs or whatever, are no longer covered under employer-based thing, cannot buy commercial insurance because of their age, pre-existing conditions, whatever. The public option would give them an outlet to get coverage.
Great. Well, there you have it. The majority of doctors here in our country do support a public option within healthcare reform.